Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Is about 10 items that they identified that were helpful in terms of bathing. First place, they said that it improved heart health. It would help you breathe better. It positively affects the brain and the central nervous system, reduces pain, inflammation, and calms the central nervous system. It also benefits the muscles, joints, and bones, and especially stretching. If you do aerobics in water, that helps. But the bathing helps your blood and improves your immune system as well. They talked about cold water bathing, and I thought much about Darryl, because they echoed exactly what he said about how it helps muscular activity and is particularly helpful in that regard. Probably little else does it as effectively as cold water bath, they mentioned. They talk about it also being helpful for fibromyalgia and chronic fatigue syndrome. It also balances the hormonal system. And it also cleanses and moisturizes your skin, your hair, and eyes. It helps your body temperature, and it doesn't have any real adverse effects. Now, it doesn't say that you have to bathe daily. It just says that you have to bathe. So anyway, those are the things that they said about bathing that Carol had asked us to do some research on that, so we did. Any questions about that before we move on?
Yeah, I'm thinking about that guy that we saw last week that hadn't bathed in 60 years or something. And
Right.
As soon as he took a bath, he died.
Well, that's not what it said. See, he didn't take bath until 60, but he died in 90.
Yeah.
Soon after that. But 30 years is not soon after. He died at 90. He didn't die at 60.
Oh.
I mean, 30 years is pretty long.
Yeah.
So the way they write things sometimes is you have to be careful about interpreting the journalistic efforts.
Yeah, he cut half his life away.
Well, I can't. He died at 90, so I don't say I get it that way. He just didn't bathe. That's all.
I hope it's not becoming a trend. A couple of weeks ago on the news, they were talking about, and I cannot think of his name. He was the one who married Demi Moore, the young guy, and then divorced. And
Ashton Kutcher.
Yeah, and they have 2 kids, and they don't bathe them. So of course it was a big hoopla for weeks after that. About when is the best time to bathe and how do you do that. So I hope it's not going to become a trend. But then again,
it won't, because I think everyone knows. I think the reason it was put in the newspaper because it's an exception.
Yeah.
But anyway, they talked about the 10 healthy consequences of bathing, and they found no adverse effects of bathing warm water or cold water.
I can agree with some of the clauses that you enumerated, because, for instance, in myself, when I bathe after exercise, I feel my muscles relaxed, and when I bathe immediately after I wake up, I feel energetic. I feel like going to work, going to do something. So I can agree with some of the things you narrated on the plus side.
Right. Okay, John Buchanan, if there are no more other questions, we can go ahead with the articles. But again, it didn't say you have to bathe daily. I thought people might be interested in this because I don't know how many times. I'm sure everyone who's got an email has been hacked at least once, right?
Yeah.
Yeah.
Yes.
So I thought that everybody might be helped by this. I've had hacked at least 3 times. So, how to spot fraud? That's a good question. And I think the first thing is they say here, the sender's address is often the first, and sometimes they put the topic. And if they tell you they're going to send you some money, be suspicious. I've gotten at least 100 emails from people who are going to send me money, and they even have the name of Warren Buffett or Bill Gates and all kinds of things. So the address is probably the first tip-off. Any email request to sign a document, never do that. And then dear DocuSign customers, a common greeting. But most of the time they have your name, which is interesting that they have your name. They say, dear Clive, or dear whatever, first name. Like we know you.
Could I interrupt for a second?
Yes.
Very, very common when a hacker is trying to get in. I've received email that has my name on it. Okay. And I have friends that call me that say they got some email that had my name on it. And I said, well, just take your mouse, go up to that name, and it'll show you the actual address, not just the name that's on the cover of it. It'll show you the actual email address. And if you don't recognize that, then don't even click on it. Don't even open it to check it out, because it could have viruses in it. So I just wanted to say that.
That's a nice one. That's a nice one. I never used that one before. Yeah. And just as you said, they give you a false sense of urgency. You know, I need money. I need this. Can you help me? Do you have a Amazon account? Those are some of the things that they send you. Bad grammar, that is not unusual in the legitimate ones or the illegitimate ones. And then this is interesting. If they don't have HTTPS for the website address, you may use that as an idea that's not secure, although I've not noticed that. And then pop-up boxes aren't secure, and I have those as well. I've had hacked by those as well. So, any other things that you have identified? As you know, the fraud business is really becoming big time, and hospitals and universities have been had fraud claims ad nauseum. I think Howard has had cyber attacks at least 3 times, and most of the hospitals have at least one cyber attack. So it's important to recognize that. What do you do after you get hacked? Is a question that has come up often. Of course, when I had got hacked, I took my computer back to, it's a university computer. So I took it back to the university and get them to resolve it. But how about those people who don't have, if you guys your own personal computer, you can take it to the what's the name of that company that actually does all printing and
You talking about the Geek Squad?
no, the big store that will email.
Staples?
What is it?
Is it
Staples.
Staples?
Staples, yeah. Staples will do it for you at a price.
Yeah, at a price.
At a price. right.
One thing I noticed in a and I actually clicked on it, and then I realized that that really wasn't the case, but they had my name, but then they in the article it had a friend's name. You know, it wasn't just someone I didn't know. It was actually a person I knew's names, and she was asking for me to do something for her.
Yeah, yeah.
And I clicked on it, and then I said, no, she wouldn't have asked me. So then I called her, and when it wasn't her, I went back in and deleted it.
Yeah, it's, yeah, it's amazing how they can do that, and also tell you if you don't give them the money they ask for, then they will block your
Yeah,
missions. Yeah,
yeah.
and
Cut your email off or something like that.
and actually asked for millions of dollars. They did that with Howard University as well.
Mm.
But if you call they called the FBI, and the FBI indicated that most of them are not. They don't keep their word anyway. Even after
Uh-huh.
you give money, they don't do anything to help you.
Sometimes they say they are the FBI or
Yeah,
the IRS,
that's true. Yeah, that's right. Yeah,
but they target 65 and older more so.
yeah, yeah.
And that's us.
Yeah, I
Yes.
haven't experienced when my mother was alive. She got one of those calls, and actually, it was a debt relief company, and she had a lot of debt. So it's like perfect. She's okay. I'm gonna respond to these people, and she gave them their phone. She gave them her phone number, and they called her. She gave them her passwords and
No.
her account numbers, and they were taking out, once I got on board, they were taking out $750 a month directly out of her bank account
Mm.
to pay her bills, and it turned out that it wasn't a real fraud, but it wasn't what she wanted, and we got them to refund all the money that they took out, but we had to go to the Better Business Bureau.
Wow.
Mm.
Yeah.
But she was 85 years old or something like that, and very afraid of her financial situation. So they took advantage of that.
Mm-hmm.
That's probably one of the lesser situations because they can take thousands of dollars from the people who don't know any better until they take all as much money as you have,
Mm-hmm.
and uh, they have, they have no sense of
Decency.
honesty at all. I mean, they have no heart. They're brutal. They'll take every penny you have. So, but anyway, so it's important to be aware of the commonness of this kind of threat, cybersecurity threat.
One more thing, Doc. Last month, I looked at my bank statement, and I had 5 charges on my bank statement for $80 each, and it was from a company in China.
Oh, wow.
I had absolutely no dealings with them. I don't know how they were able to do that, but they got into my account and took this money out.
Wow.
And I know I found it exactly when it happened, and called the bank, and they locked the account, blocked that person in China, and refunded them because they took the money out. It wasn't that they were going to. They took the money out.
Mm-hmm.
So this is something you really have to pay attention to your bank accounts, to all your credit card accounts, just to make sure that every charge is valid.
And when you do have fraud on your bank account, they usually lock your debit card. And so if you do things like buy groceries with your debit card, you got to wait that week to 10 days to get a new one.
Yeah, that's
Yeah.
right. Yeah, it's not fun at all.
That is true.
Okay, we'll go to the next one, but it's something that I thought everybody should be aware of. I thought this was fascinating that John found that Oregon could be the first state to make healthcare a human right. It's a sad commentary because the World Health Organization says that healthcare should be a fundamental human right, but it's not in the United States. And so Oregon voters are being asked to decide whether they want to do that. So it's going to be interesting to see. Next week, the ballot will go out, so we'll see what happens. Yeah. But interesting that they would do that without any funds. Because you can't do that without money. Otherwise, it's a kind of false statement.
You can say it is, but doing it is a different story.
Right. You got to have money to do it.
Yeah.
I won't make any comments about that. What Trump tried to do with Obamacare, but
Yeah.
past history, and we all know it. But anyway. So it's going to be interesting if they pass it. How are they going to fund it? Because that's the other issue. Passing it without money doesn't help. You have to put aside the money for it. And that's a lot of money.
Yes, it is for a state.
And a lot of people, this is true. They don't have insurance; they would be dead, and a lot of them are dead because they didn't have insurance. And, the green screen is something that we talked about in 1996 relative to liver transplantation, because if you didn't have insurance, you couldn't get on the transplant list, and if you didn't get on the transplant list, you died. So we call it the green screen, and it's still applicable today to some extent in many issues, particularly areas that that are unlike transplantation and kidney disease, where you have a nearly universal health care, but all other diseases, they don't have that. So this is an issue that we need to bite the bullet on.
You know, Dr. Callender, I would suggest that we look at some of these other countries. I mean, even Cuba has universal health care. The Scandinavian countries, Sweden, Finland, how do they afford to do it? You know,
Well, they know how they did it. It's not that they don't know; they're just unwilling to do it. And, because then, as you mentioned, there's a number of countries that have universal. Matter of fact, we are the only developed country that does not have universal health insurance. So, as Darryl has mentioned many times, it would force some people to look for a country that has that and move to it. But anyway, let's hope that we can change that in the very near future.
is it true that France has universal health care as well?
I don't know. I don't know about France.
Yes, they do. France has universal health care.
But as they say, all of the other developed countries have it. We just don't. Would you like to live to ripe old age? That's interesting. I thought it was a funny article. Choose ancestors that do not die of natural causes in young adulthood. Never inhale tobacco or smoke. Maintain a body mass index within a healthy range, like Darryl. Maintain a blood pressure within a healthy range with or without medications. Also maintain a low resting heart rate. Of course, that's the question is, you can't choose number one, and there's so many people smoking around you that you can get secondhand smoke which can cause lung cancer. And then, of course, the last three is things that you can do by many of the things we've talked about: exercise, sleep, and so forth. So.
I would add, don't live in the city, because air quality in urban environments is very poor. And that's taking on a lot of pollutants to your body when you live in a city.
Yeah, I don't live near polluted waters. These are things we talked about also. Do not consume sugar, soft drinks, fruit juices, processed foods, whole grains, above ground leafy vegetables. I mean, I guess they don't want you to eat it all.
Get ready to say.
It says do, okay, do eat, okay, do eat, right. This the do nots is the sweet stuff that we like, can't eat. Everything else, it seems like you can eat, right?
Yeah.
What do they mean, do not consume sugar either added to anything in-home cooked or restaurant meals? What is in-home cooked? Or I know what restaurant meals, maybe I'm not understanding this completely.
Or if you put sugar in something that you cook.
Oh, okay.
Yeah,
That all has to do with sugar.
right. All has to do with sugar.
Oh, okay.
The wonderful, good tasting sugar.
Well, fruit juices are fine if you squeeze oranges or something like that.
I think, yeah,
Okay.
I think they're talking about processed.
Process.
Yeah, but
Yeah.
I don't have any. Well, anyway, that's their advice. So.
Yeah, the sugar in
Don't
fruit.
eat anything sweet.
Yeah, the sugar in fruit is not the same as like you squeeze the juice, or if you eat the fruit whole. If you eat the whole fruit, it has fiber, which slows the absorption of sugar. And
Go
so,
back up to that other one because I want Darryl to see this one. Don't fret about milk, because I know Darryl has talked about in our population that milk is an issue, and it is an issue. But anyway, they don't think that's a big issue.
Well,
oh
I like
yes,
that part.
Enjoy yourself in moderation.
Yeah, that's
Dairy,
Bible.
dairy is not an issue for white people, but I like the thing about, everybody says no fat, low fat, avoid fat. And fats are, except for trans fats, they're not really bad. You need a
That's
little
right.
fat in your diet.
Yeah, you're right. Good point. Um, do drink alcohol, but not before 5 p.m. And don't binge. Never ever use street drugs because you never wake up again. Opioids, except for short-term relief of pain. This again says about the sleeping without sleep medication. Do not drive after drinking. Do walk up and down stairs, but be sure to handrails, especially if you're over 65. Be active sexually, socially, mentally, and physically. Keep no firearms within your home or workplace, especially if you don't know how to use them.
If you have children.
This is interesting wildlife. Interesting comments about that. Then under here, value whatever family life you have. It gives some interesting common sense things.
Scroll down a minute, John. I wanted to point out, Carol had a cousin that went out to watch the birds. And so that might not be so bad.
Well, they're saying that you should do it.
Didn't your cousin do that, Carol?
Uh-huh.
But they say that that's something that you should do. Birds, bees, trees, plants, flowers, and wildlife. I know a number of us like to plant things. That's a healthy practice.
The only thing on that list, I always stay away from the bees.
Is what?
I would stay away from the bees.
Oh, yeah, so would I. Yeah.
Morning.
I have two of my friends are beekeepers.
Yeah,
Ooh.
that's interesting.
And
Interesting.
they love them.
Yeah, that's interesting. Yeah, I saw a movie about that one. Beekeepers. Then social economic factors, just common sense factors. You know, it makes sense. All of these are things that we should be doing anyway. Respect the value of spirituality and religion, and try to earn and retain as much money as needed to control your healthy environment into ripe old age.
Yeah.
Medical actions, of course, most of the men need to take charge of their own health and listen to your body. And all of the use hearing aids as needed. We've talked about that for a while. Your dentist every 6 to 12 months. Stay up to date with your vaccinations. Don't be shy about masking these days. So true. Take as few medications as possible. Utilize acupuncture massage as appropriate. And this is interesting, use moisturizing skin lotion, especially after sun exposure. And this saline nasal mist is catching on a lot.
Mm.
Dr. Callender, I have a new doctor who from Howard University, and I just met him last month, and he got me off of my vitamins, my glucosamine, chondroitin, my fish oil, the multivitamin. He knocked out a bunch of things that I was taking, and so that thing says take it as few medications as possible. You know, even if you have those issues of arthritis and things, take as little stuff as you can, extra stuff.
You remember Dr. Obese-san made the same comment about people of our ages. One of the most important things to do for some people is to make sure that to take as few, just as you said, take as few medications as possible.
Mhm.
Exercise, we talk about that ad nauseum, and they emphasize us. And of course, Buchanan tries to swim every day. So yoga, there we go. Yes. Oh, good old yoga.
What is sarcopenia?
I think that has to do with muscle depletion. If I think so. But I haven't looked it up in a while, but I think it has to do with muscle depletion because as you age, your muscles fade away. And so exercising is a way to slow that process down. This is interesting. Standing on one foot, I try to do that occasionally and fail often, but it's something working on balance that we can do.
That's one of the things we do in yoga too. We practice that the swan.
Yeah, yeah. It's good exercise. I do it and fall a lot, but anyway.
Right now, I'm trying to stand on 2 feet.
Okay, all right.
Yeah, we have to master that one first.
That makes sense.
Move to 1 foot later on.
Yes.
Yeah, wait a while for that feet. The rest of us who are on 2 feet can work on that. John, you mastered that with yoga? You can?
Not mastered, but you know, it's a practice. You have to practice it. They say you can hold on to a chair or a wall if you need to.
Okay.
Thanks for that.
Yeah, absolutely.
Okay. Is that the end of it?
Well, you kind of skipped this one. The wearable devices, the watches, and the wrist.
Yeah, I think I think that's a lot of. I think for those for whom it's helpful, they should do that. Yeah.
Yeah.
Look at this one. I just had a friend who I grew up with
Not retired.
who retired, and I think it led to his demise because he started to feel useless. See, it's not like Darryl, who went from one expertise issue to another, and that's what. See, if you retire from one thing and go to another, that's not retiring. That's just actually going from one enjoyable thing to another, perhaps, or maybe from one unenjoyable thing to another enjoyable thing. But I think most people would say, stay active and have a reason to get out of bed each morning. Good advice. Any other thoughts about this?
My neighbor told me, I retired from the second job in 2017. And the other day, my neighbor said, Betty, I see you out here getting in your car now more than you did when you were working. And so that's kind of what I'm doing. I'm you end up doing so many other things than you could do when you were working.
Yeah.
So,
yeah. Yeah, it's good. I think that's great. That's good. Good she observed that. That's good for you. I like this comment about pain. I check my pulse every morning and I'm still alive.
Back to work. I've got
but
a comment.
Arthritis is with most of us. So, but
I've got a comment about working. We spend usually the first 20 years of life trying to figure out what you're going to do for the rest of your life, and then we get to about 65, and most people retire without a good plan for what they're going to do for the second part of their life after they retire. And I just remember that the whole time that I was working, I was planning what I was going to do in retirement. But that's good coaching for our kids and grandkids, because they're going to get to that age, and if they don't have a plan, they're going to waste a lot of time and possibly mess up their second act because they never had a plan. But the time to work on a plan is always when you're young.
Great advice. Great advice. Great advice.
Well, in my case, life just stepped in. I had to end up doing things that I've, taken my grandsons to work, and my husband stopped driving. So then I had to drive him everywhere he had to go. So life just happened after I stopped working.
Very interesting. Okay, I think this is a good article. Nice, nice points that shared by everybody. I put this in because we discussed this about 6 months ago, I guess. And we haven't talked about it since then. This did it because of Halloween, but anyway, this is something that you can do. You can become a donor in life or after you die, but you can also donate your body to science. And it's interesting to go to some of the ceremonies they have for those people, for the families of those people who left donated their bodies. And some of the most meaningful services I've been to have been those where the medical students celebrate the families of those who donated their bodies to science. And it's food for thought for people who aren't able to be used as donors because they die under circumstances that don't allow it, but still have their bodies to be used to help others. So it's just food for thought for some who may not have thought about it, who can't be donors, but they can donate their bodies to science.
Well, I'm glad we're looking at this article, because I was wanting a cremation instead of a standard funeral because it's cheaper, but donating my body to science is even cheaper. because
Yes,
there's no cost at all.
Yeah,
And
it's
when I think about all the young kids that are victims of gunshot violence and there's not life insurance, that's a good solution for their parents too, to donate the bodies to science.
true.
Grandeur.
Say again?
I said some families want grandeur. They want to, when someone is killed, they want to kind of keep it going. So they want funerals and so.
Well, one of the best things is when that happens, they can become donors because organ and tissue donors. So
Yeah, that's true.
it's food for thought. One donor can save 8 lives and contribute to 80 tissue donations. So that there's a lot can be done after death.
They can still have a funeral.
And you can still have a funeral. That's exactly right.
Oh, okay. Yeah. Maybe if that's put out there more, it may catch on. Who knows?
Well, we've been trying that for about 40 years. And we will keep trying.
Keep trying. Yeah.
That's what MOTEP has been all about since
true.
1991.
Yeah.
When you donate your body to science, do they want an embalmed body or non-embalmed?
They usually embalm the body. They will usually embalm it, yeah.
Dr. Callender, you had told me one point, they can embalm the body, let you have the funeral, and then take the body after the end of the funeral, and you still don't pay anything.
No, what are you talking about? They always embalm the body.
Yeah, they embalm the body. So while the body is embalmed, they can have the funeral service, and then at the end of the funeral service, it goes to the hospital. And if people understood that they don't have to pay anything to the that their body is donated to science, they get it embalmed, they can have their funeral services, and then the body goes immediately to the medical facility and no money overhead. I think a lot more people, and thinking about it, that is the best way to go. And that way you satisfy everybody.
Yeah.
At the funeral, do they use a casket, or is that a rental casket where it goes back to the funeral home after the body goes to science?
See, that's the one thing, the casket costs money.
Yeah.
No, it doesn't.
You can rent one.
You can
rent
one.
one, and half the time it's a cardboard thing. I know it happened to my brother. They wanted to do a viewing, and they chose to cremate him. And the funeral home offered a casket, which looked normal, but it wasn't. And then after the funeral, he was embalmed and everything, dressed. And after that, he was cremated.
The biggest thing is to get the funeral home out of your pocket, because they will gouge you for every penny you got. So if you can somehow avoid using that funeral home whatsoever, and you can even make your own programs, and you call me and I'll run it off for you. But don't use a funeral home under any circumstances, even renting that casket. I bet there's some place where you can rent a casket and then don't have to involve that funeral home.
Well, another alternative
to the church.
Well, be careful with that too, because on TV just this week, a family rented a casket because they were going to cremate, but the casket had information in it, the funeral programs, death certificate of the previous person. Someone used it, and they named the funeral home locally here in this area, and it was on TV. So some funeral homes aren't as protective of the information. What you're saying, Carol, sounds great. To pass that information on, you don't have to put out that money. And Betty is right. Some people want to do it up big. And in the cases of all these young people being shot, and
they want GoFundMe pages and get money and stuff like that.
But this is even for older people. They don't want someone like Darryl. They don't want someone else getting rich, and they want to leave their money behind to people like me. Not that I'm gonna, Darryl will outlive me anyway, but this is a good way for parents to leave all their money to their children or spend it all up, and then that way nobody has to pay anything when you die.
Okay.
And if you belong to church, you can have it for free. But you gotta belong to a church and pay your tithes and dues. Because other than that, like if my church decided to raise it $1,000 to rent a church out so you can have your funeral there.
Yeah, everything costs.
So what do they do when they take your body to the grave site and then they wait for you all to leave and everything? What do they do?
Don't leave.
And then don't they use that grave site for somebody else?
You don't have to go to the grave site, because if people are cremated, there people are getting used to it now. Just have the repast, and there's a way you can get that done cheap too. Have a repast, let them all eat, and then go home and say that the body is being disposed of. You don't have to go to the cemetery anymore and pay those high prices. I should write a book and then give
Yes, you should.
a book. How to die inexpensive.
But good morning, everyone. But one concern I have is the time that the person deceased and the time period of the body, the process of the body in death to the time of whether you're gonna, whatever stage you're gonna do for preparation, whether it's donation of the body or what, there's a time period of there that you have to meet. Anyone know that time period? Because the is decomposing.
Well, no, as soon as for example, if it happens in a hospital, then they immediately put it in the refrigerator. But if it happens outside and within an hour, decomposition sets in. So it has to be done in a timely fashion. Otherwise, a decomposition sets in and everything is destroyed.
Right. Because
and for example, for donation for tissues, you can do that within 24 hours. For organs, you have to do it within 60 minutes. Yeah. So.
Yeah, because my experience working at a funeral home, I mean, way back, was that the reason people use funeral home was the embalming process.
Yes.
But like Dr. Callender said, it's that gave me a refresher of the time periods that you have to move on it because of the decomposing of the body and coming out the morgue and all that kind of stuff. Because I went to so that is a concern that you have to factor in that body decomposing process.
Absolutely.
So what you're saying, Dr. Callender, is it's much easier when a person passes in a hospital to donate than it is for somebody maybe that would die at home or would be shot or.
Well, it depends on whether you want to leave organs or tissues. For organs, you need to have the organs within 60 minutes. For tissues, you need 24 hours, within 24 hours.
Okay, if you set up prior arrangements with something like Howard University Hospital to donate your body, can you have them pick up the body and that way all the refrigeration costs and embalming costs are on Howard?
Of course, Howard isn't doing it now, but as a matter of fact, the only place that's doing it now is the VA. I'm sorry, the Walter Reed. Yeah, was the only place that's doing it now. But yeah, for the most part, I think somebody had asked me that question. I had them communicate with Walter Reed, because they were the one that were doing it, especially during the pandemic, because all the other places had stopped.
Mm.
But that is the place around here. I don't know about Illinois, because see, that's a busier city, and you may have more other universities that are still doing that. The pandemic slowed down the number of, before most university hospitals were doing that, but after the pandemic, a lot of them stopped it. Only a handful of them continue to do it in different areas. But I don't know about the Chicago area.
Hmm.
This is interesting. Count your blessings one by one, and you fall asleep. Remember that? So
Yes.
count your blessings, name them one by one.
Yes.
Yeah, and so this is
Go ahead now.
a simple breathing technique that they recommend that will help you fall asleep. You know, we take it for granted that you fall asleep easily, but that isn't always the case. And being unable to fall asleep is not good. I remember whenever you have death, some people after they lose someone, they can't sleep. I remember my brother, when he lost his wife, he didn't sleep for a month.
Mm.
So and then you realize how what a difference it makes, because your brain doesn't decompress, and it's awful actually. So, and that's why they recommend these breathing exercises, because sleep medication is not good for you. So
Really?
I've never tried any of this. I've been blessed. I can always fall asleep. But inhale through your nose for count of 4, hold your breath, count of 7, exhale for count of 8. I don't know anybody ever tried this?
No, I didn't know that before. But
I just now tried it since the article's been on the screen. I haven't fallen asleep during the group session yet, but I am more relaxed.
Uh,
Dr. Callender, why did you say sleep medicine is not good for you?
well, they have side effects, that's all. Some of the sleep medicine doesn't. If you have a sleep medicine that doesn't have side effects, it's probably okay. Although, but many of the sleep medications have side effects. Some of them you hallucinate, some you go to sleep and you walk around and do all kinds of
Yeah, no, I
strange
don't.
things. And so I just say that if you wanted to take a sleep medicine for a night or so, but for over a long period of time, it's unwise to rely to sleep on sleep medication. That's my feeling about it. Now, psychiatrists and psychologists still prescribe sleep medication for a short while for people who can't fall asleep. So, and for those people, it's probably okay for a short-term rest. But I had a number of my transplant patients who, after they took the sleeping medicine, they went up cooking and doing all kinds of things, driving and all kinds of things, and they didn't even know it. And so there are side effects from some of the sleeping medications. So if you took some for sleep and it didn't have side effects, that would be okay for a short term. But I think for a long term, it's not good for you. Any your thoughts about it? Any comments about that?
When we start yoga, we do this intentional breathing practice, and it helps to relax all your muscles. By the end of an hour of yoga, your body's really, really relaxed. But the process at the very end, where you're just lying there, you end up going to sleep a lot of times, because your parasympathetic nervous system is activated during the practice. But we start off, like I said, with with total, as best you can, relaxation. Even that single nostril breathing that they talked about, they do that to help know that you have control. Otherwise, I mean, who thinks about your breath? You know, it's part of you. You don't even think about it.
That's
But
true.
when you work on controlling it, you find out that you do have power over it, and you can use it to prepare for exercise and to wind down after exercise.
Mm.
Okay, all right. Well, scroll down some more, let's see what else. Well, it's interesting that breathing can be used effectively for not only for combating insomnia, but other things. The other thing that sometimes those sleep medications do, they produce hypnosis. And that isn't all that fun either. I've had patients complain about the melatonin and other things like that that also produces some degree of hypnosis. And that wasn't fun either for some people.
Melatonin.
I know with my mother, we had to stop her from taking Ambien because she was having hallucinations.
Yes, oh yes. That is, Ambien is well known for that, yeah. And hallucinations, doing all kinds of things that you aren't aware of while you're sleeping. Yeah, so.
What did you say? You mentioned melatonin.
Melatonin also has side effects. The melatonin is a hormone that's produced by the body, and that's used to treat insomnia as well. But it's not tolerated by everyone the same. But now this is probably the second or third article we've had about sleeping 5 hours or less causing chronic diseases. And for those in medicine who have poor sleep habits, it is something that we deal with all the time, and it's not good. And it affects your ability to perform. One of the things is when you do something repetitively, you can almost do it in your sleep. And so you get used to short hours of sleep, but it's not healthy. And this is a long laundry list of diseases that is associated with sleeping less than 5 hours a night. And I think that this is something we've looked at before, but you can take a brief time. It's interesting how children sleep so long.
Mm-hmm.
Hi.
Did you realize that kids slept this long? I didn't realize that.
You seen
Yeah, when they first born. Yeah.
oh, he's in the date. That's all right. Don't yeah. Okay. Yeah. Tell him they break.
At the top of this article, it showed a couple people sleeping in bed. And what I noticed is that the pillows were sitting up pretty high, which is a great idea. You know, the guy's a back sleeper, obviously. The woman's a side sleeper, which is better because she's smarter. But I went to an ENT doctor this week, Monday, for my snoring. And he says, just get a higher pillow. So I got an anti-snoring pillow from Amazon that's shaped like a wedge. And so that cured my snoring. I don't snore anymore.
Interesting. That's a new one. That's interesting.
I know your fiance is happy.
Well, yeah, because she's still snoring. She didn't get the high pillow like mine.
Not only that, we had a doctor come on and tell us what the best sleeping position is. And she said sleeping on your right side was the best sleeping position.
Well, when the ENT did my examination, he was looking at to see if I had any deviated nasal septums, and so I could see on the screen what he was looking at on the scope. He had it on the TV screen, and he said because I didn't have any deviation, but the left side of my nasal passage was a little smaller than my right side. So he suggested that when I sleep on the left side, which has been my preference, that's the best for me because gravity um, causes. If I sleep on my left side, it causes that air passage to open up a little more. So it best suits me for the way that my nasal structure is built.
Yeah, I think this doctor that came on, she said in general, left side sleeping is the best.
Right, but I know anatomically, when you look at the way the GI tract is forms, that actually, especially if you eat before you go to bed, sleeping on the right side is better for your indigestion, better for your digestive processes. But I think right side or left side, as Darryl is pointing out, it varies on your own anatomy. I personally have worked with patients with intestinal obstruction and other problems, and have to put down tubes for patients who weren't able to digest their food, and the right side worked well for them, but I think it varies a lot. So
the side is better.
I wouldn't opt for telling anybody which side because it varies. Just as Darryl said with his anatomy, the left side is better, but for some people the right side might be better as well. Flat is the one thing about pillows. The people who require pillows, it makes you think about the need for think about heart disease, because also one of the things that happens when you have heart disease, you have to have two pillows in order to sleep, because your heart is not pumping out fluids adequately.
You got heart problem. So the side is better than your back. Is that what you're saying? Either
For many
side.
people, for most people.
For most people.
Now, as Darryl has mentioned, there are other reasons. There are many other reasons. Some people have back problems. Some people have other problems. So I think the side works for many people. It's interesting to hear how that the pillow works so well for him.
I just use a CPAP machine.
Ah,
Pearline, you need to mute. There you go. Yeah, I use a CPAP machine. Stop my snoring.
Well, that's the treatment of choice for obstructive sleep apnea.
That's what I had.
Yeah.
With my doctor's exam, he said I wasn't likely to have sleep apnea because I didn't experience any loss of energy, tiredness during the day. When he looked at my anatomy, I didn't have things like an enlarged tonsil or any larynx problems, and so he said, you probably don't have sleep apnea. I just recommend a higher pillow or the breathe right strips across your nose.
Right. Yeah, it makes sense. You're right. Because people with sleep apnea, they're exhausted all the time because their oxygen level drops, which makes them unhealthy and causes hypertension and other things. So, yeah.
What
Was there a comment?
Yes, going back to another discussion we just recently had about there are a lot of variables and it depends on each individual. One thing we discussed in another article is not going to bed on a full stomach. So those are other variables that we want to consider in getting a good night's sleep, and making sure that your water intake It's not all at night. It's not when you get ready to go to bed, because you know you'll be up all night between you and your friend in the bathroom. And the last thing I want to say is that you have to make sure that you're eating those right nutritional foods, because you got one of the things that is recommended, that you have to eat foods that make sure you get your calcium, your chromium, your copper, your magnesium, your vitamin B complex, your vitamin B1, vitamin B, E, and zinc. So you have to make sure you're eating those superfoods and those foods that you need to get that good night's sleep, as well as, of course, we say now the 7 pillars of health.
Okay. This article talks about, we talked about BMI. This article talks about how waist-hip ratio is better than BMI for predicting mortality risk in obese patients. And it's interesting because we haven't talked recently about it, but we've talked before about the fact that having a fat butt is better than having a fat belly. And some people feel that Black women have fat butts and that's healthy, and the fat belly isn't. And so the waist to hip ratio becomes an issue. And that's measuring your circumference between the waist and the hip, rather than measuring your weight and your height. So there's a number of concerns in which they do both, the waist to the hip, as well as BMI. But waist to height ratio considered is thought to be a different issue, because they say it correlates more with whether you're going to die from obesity than anything else. Now this is interesting because I think we actually did a research project and we did both, but we didn't really look for a difference. And we actually used, for the most part, the BMI. But this is interesting that this shows a better relationship. Of course, that what they're looking for is how it is associated with death rather than anything else. And they talk about that the visceral adiposity, which is fat bellies, is more common among men compared with the women who have big butts. So,
Dr. Callender, I developed a fat belly, even though I'm not, you wouldn't consider me fat, but I have a fat belly. And it just happened out of nowhere, you know. I'm wondering, do you have any advice for a fat belly?
well, the first question is, what is your BMI? Then the next question is, what are the exercises that you can do to decrease a fat belly? And there's some that are recommended, and I guess we can look those up, but there are some exercises that are recommended for decreasing the belly.
Yeah, I used to be an innie, and now I'm an outie.
What is your BMI?
I think it's 30, 31. Maybe.
So you're overweight. Okay. No, no. I'm sorry. You're obese.
I'm
25 to 30 is overweight.
I'm over
30 is obese.
You're parked on the deck and you're driving.
I'm over 15 pounds lighter than I was a year ago. Because I started walking and back to swimming. So my weight has gone down. So I haven't really checked it lately, but I'm probably 30.
Okay. All right. But there are still exercises for the belly. Well, I'll have to look them up again.
Well, I would think that The two usual suspects are going to be bread and sugar.
I really don't do bread. I have a roll every now and then, but I don't do sliced bread at all. And
Now,
I stopped doing sugar a year ago.
This is an article that talks about the fact that cancer rates are decreasing, which means that some of the things we're doing are working. Now, the question is, what are those things? And there are many things that are working, and that is the exercise, the nutritional efforts, and then of the many breakthroughs in cancer therapies, the immunologic drugs that we now have been effective in decreasing deaths from melanoma and some lung cancers. So that, and then of course, we're paying attention to foods we eat, exercise, and other things. So at least in this country, far few people are smoking. But when haven't been to Europe recently, but when I was in Europe, they smoked a lot more than Americans, and still far too many Americans are still smoking. Yeah. And it's interesting that the Native Americans still have higher rates of cancer, and it's a population in this country that has been relatively ignored, and it's a population that we need to pay more attention to. But it does appear that the screenings and attention to the elimination of processed foods, as well as the immunotherapy for cancer, which has developed and has been successful over time, is demonstrating itself in the lower deaths from cancer. But still, Blacks have more cancer. The rate of deaths from cancer is higher in Blacks than it is in other populations other than the Native Americans. Blacks and Native Americans still have that issue. And the question is why. There have been many ideas, but one of the commonest is one advanced by Harold Freeman, who won the Alaska Prize for pointing out the social determinants of health, and thinks that the problem is that we get to the doctor too late, and the diagnosis of cancer is made later for us than it is for other people. And so the social determinants of health play a major role in that. This article points again that death rates across all age groups continue to go down. And I think this is good. I think lung cancer, melanoma, that's where they decrease the most. And that's good, but it's still have too many cancer deaths. Still, lung and breast cancer are still the commonest, and we have so many women dying of breast cancer. Dr. Wilson, our breast cancer specialist, died 2 weeks ago, breast cancer. Pancreatic cancer, however, is a cancer for which we do less well than other cancers. Pancreatic cancers, we don't do very well in terms of having 5 and 10-year survivals. It's interesting, leukemia deaths have decreased, and part of this, and we do have more treatments for leukemia now than we did before. It is disturbing that there's an increase in breast, colorectal, and testicular cancers in young adults. And this is why colonoscopy has, the age for colonoscopy has dropped down to 45, unless you have high risk where it can go down to 40. The alarming breast cancer death rate for us, for Black women, is something that we still have much work to do about, because far too many Black women are dying from breast cancer. And far too few Black women are having the appropriate screening, breast cancer screening. And that's something we have to work at as well. But cancer still is second behind heart disease as the number 2 cause of death in America. And we point to systemic racism as a major factor. As Darryl had mentioned before, where you live, urban living is allows you to be polluted with things that actually cause cancer. So these are all factors. Any comments or questions about that?
Dr. Callender, can I go back to another thing that we just talked about just for a second? The fat belly, isn't that caused somewhat by the muscles in the stomach deteriorating somewhat? I mean, not deteriorating, but loss of muscular in the stomach area.
Well, there's some probably that's probably not the major contributor, but certainly there are muscular exercises that are recommended for overcoming the fat belly, because the muscular deterioration certainly occurs as you age. So there's little question about that. But whether or not that is the major reason why you have a fat belly is another question. I don't think that's the answer, but let's talk more about it next week, I guess, to do some research on that, about the fat belly. I'll make a note of that. Okay. RSV vaccine data. There's hope, as you know. The children's hospitals are filled with children with RSV, the respiratory virus. And it's already, it has already taken over many of the children's hospitals already. And actually there weren't any vaccines that were effective. But now there is a study that shows that vaccination may help. So this is something that our future will help us with. It occurs in older adults too, but it's just that it's certainly dangerous for us older adults, but it's also dangerous for the younger kids. But before this time, there really wasn't a vaccine for it. So this is a new development that can be helpful.
Dr. Callender, I have a close friend that works at the Children's National Medical Center over on Michigan Avenue. And she said that they have beds out in the hallways from this.
Yeah.
Totally packed right now.
Right. And most children's hospitals everywhere have the same problem. Isn't that interesting that 58,000 younger than 5 hospitals each year, 700 die, and 14,000 die annually, adults. Not the large number associated with the flu, but still significant. Worldwide kills about 100,000 children a year. Why is there no vaccine? Well, that's an interesting question. You know, when we have a vaccine, we're thrilled to have it. This is an interesting experiment that they did in the 1960s. They found that not only was the vaccine not protective, but some people died after the vaccine. So after that, they kind of slowed down. So now we're back at it again. So we'll see what happens.
Dr. Callender, during our youth, there was an outbreak of the, I think it was what, whooping cough?
Yes, pertussis.
Yeah, is this related?
No, that's completely different. Yeah, whooping cough is something that is kind of because of medication, that vaccines. Because we have a vaccine after pertussis. It's just about knocked it out. But RSV is different. So I guess we're all hopeful that the data will show that they have a RSV vaccine that is helpful and not harmful. So we await that. But it looks like it's more dangerous for us older folks than it is for the kids. Interesting, they talk, at least nowadays, they have more studies on women. I think what was different about the coronavirus vaccine was that they overemphasized the importance of the minority population. And so the questions are they doing the same thing for this RSV vaccine? There was, along those lines, an interesting article in the Washington Post that talks about this group called the Million Veteran Program, in which they have the largest database for Black people in the world. And these are all veterans who agreed to send their information and be accumulated in a VA data bank, genetic data bank. And so when you talk about areas where they have data on Black genetic issues, this may be the largest in the world, even larger than the NIH one. And it probably has more Blacks in it than anyone else because most of the veterans are actually, many of the veterans actually are Black. So when we have issues that cause us to have concerns about issues like, we haven't talked about the APL gene, but that is something that is common in the African American population and causes kidney disease, particularly in those people who have HIV and also in coronavirus, apparently. So, because you find more people with coronavirus who have kidney disease who are Black than other ethnicities. So it's nice to know that there are some genetic banks out in this country and outside of this country that have genetic material that can help us answer some of these questions.
9, 4, 0, 6, 9, 1, 2.
Now, this is something that makes sense to me. You know, getting COVID vaccines to routine immunization down the road when we know a little bit more about it. Right now, to me, I think it's a little early because we still aren't sure how often we're going to need to be vaccinated. Right now, we're doing booster shots every 6 months. How how long will that be necessary? When will it expand to once a year? So far, it hasn't done that, but it's likely that down the road, this will actually occur. So it's not something that is mandated now, but it's something that is food for thought and something that we need when we have the data available, which we do not have now. That may be something that we will add not only to childhood immunization, but to adult immunizations, so that we will be getting the flu vaccine annually and maybe also the coronavirus vaccine annually as well. But right now, we don't have the information. We do know that they have the lowest rates of hospitalization and death from COVID. Know that, but we don't know some of the other answers to questions. And we know that COVID is an ongoing problem. We don't know what's going to happen this fall, but the fall is here. As I go to indoor events, I see fewer and fewer people wearing masks and paying attention to social distancing. And so it's going to be interesting to watch and see what's going to happen. Now, this is something that we knew was going to happen. $110 to $130 per dose for the COVID vaccine. Once the United States government purchasing program ends, which is likely to happen next year. And so what will that do to the uninsured or uninsured? That's interesting. Here we go back to the issue of not having health care as a right, which it isn't. So, and this will then impact upon the minority communities disproportionately. Let's go to the next one. This is an interesting article that talks about the fact that those of us who have side effects from the COVID vaccine, it's interesting, some people do and some people don't. But they are saying that if your body has a great antibody response, then that means that your immune system is affected positively by the vaccine, and therefore it should work better for those people who have side effects, suggesting that those people who don't have any side effects may not be impacted by it at all. But I don't think there's enough data to say whether or not, if you don't have a reaction, that you don't have a good response to the vaccine. But there certainly is evidence that if you have side effect, that your vaccine response is good. But the other way, I'm not sure about, because I do know a number of people who have no response to the vaccine in terms of side effects, while the majority of people do have some side effects. Some people have none. Any comment about it? Any of you who've had the vaccine and the boosters who have no side effects?
I've had 5 shots, no side effects.
Interesting, interesting. Anybody else with no side effects?
Me, no side effects.
Yeah.
Wow.
Well, my only side effects is just a sore arm at the injection site.
Me too. Yeah,
Yeah.
mine is sore arm and just tiredness.
Yes,
Yeah.
same here.
Right.
Full
Yeah.
arm and tired. Well, I just went to bed.
Yeah.
And
Okay.
me too. I was tired for 3 days, but I stayed positive for 11.
Yeah. Well, it's kind
After
of interesting to look at the population who has no side effects at all and see what that means. We don't know what it means yet. We do know that those people who have side effects, that it's a positive response, and that it means that the vaccine is eliciting the appropriate immune response.
Dr. Callender, I had absolutely no side effects whatsoever And I thought that that was because I have so many other comorbidities that I wouldn't even know.
I don't think it's the comorbidities, it's the medications you're taking to prevent rejection. That's probably why you don't have side effects. And the other patients, some of the other patients that I know who don't have side effects are on prednisone or other immunosuppressive medication. So that's another reason why you wouldn't have side effects.
And no injection site problems either.
It's even more suggestive of the impact of prednisone and the immunosuppressive medication.
Yeah. The injections site should have caused a problem, but that didn't even cause a problem.
Right, yeah. Yeah, I think it's different for patients who are immunosuppressed. But again, they need to do more studies on that to prove it, yeah. So early counts of flu are already breaking records, but let's hope that that does not continue to be the case. Already 880,000 flu cases, 360 deaths from flu already. So let's get the flu vaccine if you can. So because it doesn't necessarily stop you from getting the flu, but it decreases the likelihood of hospitalizations and death. So those of you who haven't gotten the flu vaccine yet, you might want to get it.
Dr. Callender, I got my flu shot Monday. Now, is there any special flu shot for people over 65?
Yes, there is. And you have to specifically ask for it. I've said that on at least 5 occasions.
I know, I had a little debate with my wife about that. The thing
You need
about it is, I didn't know whether it was a double or just a different type of vaccine.
There's a special vaccine for older people.
Oh my goodness, what do I do now?
Well, you just ask whoever vaccinated you if they gave you the older. How old are you? 65?
Yeah, I told him that I'm supposed to get a special one. He said, no, you just get the same one everybody gets. So,
Well, that's where are you located?
I'm over here at the Future Care Capital Region Rehabilitation Center.
So do they have a lot of older people there?
Yes, they do.
So that may have been the vaccine that they got, but it is a special vaccine for older people. And
Oh, okay.
it's double the dose of the normal vaccine. And I got my vaccine last Saturday, and I asked particularly for that vaccine, and that's what they gave me.
Okay, I'll check backwards.
Yeah, because it's a double dose.
Okay.
And for all of you going to get the flu, always ask for that dose for the older people. This is an interesting finding that people who had COVID, they don't have the virus in the heart, so that they could be donors for heart transplant. This is something that they found out now. At the time, we didn't know it. So if you were positive for COVID, you were not accepted as a donor. But now they're saying that that if you had COVID, that the heart is not infected. So, of course, we know that they've done lung transplants after the person whose lungs were destroyed by COVID were removed and replaced by COVID negative donors, and they were successful in some cases. So it looks like what we now know is that the COVID hearts can be used. We didn't know that then, but we know it now. So it's surprising evidence, because I would have thought differently. but that's the case. Now, would you be willing to accept a COVID positive heart? I don't know, but the data is indicating that they are safe. So. And as they say, this is the bottom line. Long as studies are needed and the study size is still small.
Yeah, well, do the heart transplant first and then treat the COVID after that.
Well, it looks like they don't need the hearts have done well, so they need it. Well, we live and learn as we go. This is something that we just learn now, but in the future, we now know that the COVID donors positive donors can give a heart. Okay.
Dr. Callender, just a question about that, because the heart is like right next to the lungs, and the heart gets its refreshed blood from the lungs, the oxygenated blood. It would seem like the heart would be affected, but this study says it's not.
That's correct.
Really interesting.
And but as it also says, the number of data that we have is small, and the long-term survival is absent. So we'll need more data to confirm this, but so far, that's what the data is indicating.
All righty.
Oh, okay. I wanted this included because if you've been to Africa in the last month, you need to be wary of the fact that Ebola virus has resurfaced in Uganda and in the Congo. And so if you've visited the Africa in the last month, it's important that you be aware of this. Now, here's the problem with Ebola. There's no vaccine and there's no real treatment. So travel history is important. And so if you've traveled in there, incubation periods of 3 weeks is recommended. Ebola is not something that we've had here in the United States, and we hope not to have it. But it has been in Africa and Uganda and in the Congo since 1976, as you can see here. So any of you visited Africa in the last month? Okay, well, you're safe. Now, here's what the problem is. The problem is that, before all of this airport transportation, you got a disease in one area, stayed there. Now with flights here, there, and everywhere, you can get a disease occurring in Africa today and the United States tomorrow. So this is why air travelers from Uganda or the Congo have to be quarantined, actually.
Is there any way to prevent the spread of the virus of this one?
No, the only way is quarantining, and there's no vaccine, and there's really no treatment. So keeping them away from people is probably the best thing to do. And if somebody's visited Africa, and not just Africa, but because Africa is a huge continent, but in the countries of Uganda and the Congo, then those people probably should be isolated for some time after arrival. I just put this because we have a diversity of people who attend our session, and some people may be traveling to Africa or not. But keep in mind that that this is a disease that so far has been limited to the Uganda and Congo. But the key thing is there's no vaccine. We haven't developed a real effective treatment for this disease. So avoiding contact is the only thing we can do now. Okay.
Yeah,
So contact meaning physical or
Contact with any secretions from
okay.
these people.
So if you're in the airport and you have a mask on, you should be okay, or
Yeah, as long yes, you'd be okay. But if you have any contact with their secretions, that's an issue. And that's why the travel history is really the only clue. Unless you've had close contact with somebody who had the virus. But going through the airport, just the breathing would not be sufficient. Okay. This the last one, John? Yeah, okay. Any other topics? Now we know we have to look up fat belly for next week. And